Hello everyone and good afternoon. My name is Alex Witcher and I'm the event producer here at the BIA. Welcome to our webinar this afternoon titled the MRC Pathology Nodes, People, Proximity and Path. This webinar is being recorded and will be available on YouTube from next week, so please feel free to send the link to colleagues. We will be taking questions at the end, so please use the question box if you would like to ask a question at any point throughout the webinar. We will then address these at the end. We are very lucky to have our 4 speakers joining us today. We have Dr. Aarti Parmar, Research and Enterprise Development Executive at the University of Leicester, Professor Christopher Brightling, Coordinator of the East Midlands Pathology Node, and Dr. Karin Oien, Director of the Glasgow Pathology Node with Dr. Ruth McLaughlin, also Project Manager of the Glasgow Pathology Node. So these 2 centres of innovation have come together to explain the background to the MRC supported nodes and discuss what they do as an example of the node's work. So without further ado, I will pass on to Dr. Aarti Parmar, who will give an introduction and an overview to the nodes.
Okay. Hi, I'm Dr. Aarti Parmar, and unfortunately, we couldn't have our colleagues from the MRC represent themselves today, so I'm giving an overview of the Stratified Medicine Initiative on behalf of them. Firstly, I'd like to thank you. I'd like to say thank you to the BIA for inviting us to join the BIA webinar series, and to you for joining us today. So to give an overview of the MRC, on the next slide, I've got a definition of what the MRC is. If you could move to the next slide. So the MRC is there to improve the health of patients in the UK and around the world by supporting excellent science and training the very best scientists. The MRC is part of UK Research and Innovation, and its mission is to encourage and support research to improve human health, produce skilled researchers, and advance and disseminate knowledge and technology to improve the quality of life and economic competitiveness of the UK. They also want to promote dialogue with the public about medical research, and based on the priorities that have been set out on the MRC's strategic plan, they invest in research on behalf of the UK taxpayer. So on the next slide, this slide gives an introduction to what stratified medicine is. So it's got the potential to deliver improved diagnosis and therapies. So we have the affected population in the UK. There are a number of tools that we're looking to develop to then be able to help find the right treatment for the right patient at the right time, so that when you can stratify the patients, we've got better value to predict disease and diagnostics. The mechanisms of diseases leading to new therapies can be used to help better diagnose disease. So capturing this potential requires true partnerships, and it's been really important for academia and industry and the NHS Trust to work closely together. So the MRC have the Stratified Medicine Initiative. So they've funded various different research plans over the years, and there are 6 molecular pathology nodes, which we're going to be talking about today. There are 17 internationally competitive stratified medicine discovery engines, and there's been a huge number of investment to date. We've got 36 academic and 57 commercial partners, and these are growing by the day. So if we can go to the next slide. Looking at the UK precision medicine landscape, so precision medicine covers discovery, development, regulation, evaluation and adoption. Now, where the MRC Stratified Medicine Consortia sit is really at the start, so in the discovery phase. We've also got the clinical research infrastructures in place as well. Unique positions, so they're between the development and the regulation stage of medicine, which is really quite interesting that we can help progress molecular pathology. So if we can go to the next slide. What is molecular pathology? So it's a discipline that seeks to describe and understand the origins and mechanisms of disease at the level of macromolecules. So for example, we can look at the DNA, the RNA and the protein, and we can do this using patient samples. In 2013, the MRC conducted a molecular pathology review of the UK. And the main challenges that the review demonstrated was that there's a lack of defined development path, there's a fragmented landscape, and there's a complexity of multi-platform signatures. So the vision that was recommended was that the UK will provide an optimal environment for the discovery, development, and adoption of innovative molecular pathology tests, and this will enhance the benefit of stratified medicine for patients to deliver clinical, economic, and research benefits. And this was discovered through three mechanisms. Firstly, having a path. So we need a clear map of the diagnostic development path. The second part is that we need proximity. So as I mentioned earlier, the research base, pathology services, and industry have become separated, and we want to bring those together. Thirdly, it's vital that the UK skill base should be enhanced by developing future research, and that's something that we're really looking to invest in. If you could go to the next slide. Could you go to the next slide for me, please? Thank you. If you could go back one. Thank you. So based on that molecular pathology review, the MRC created 6 pathology nodes. So funding was given out to 6 centres of excellence to form these pathology nodes to look at molecular pathology. So today I've got with me Professor Chris Brightling from the East Midlands Breathomics pathology node that will be talking about their node and what we're doing within there. And then we've also got Dr. Karin Oien, who's going to be talking from the Glasgow molecular pathology node. So I'm going to hand over to Professor Brightling that will give you an overview of EMBER.
Aarti, thanks for an excellent introduction. So I'm here today. Call it so I'm a clinician for ICU lung disease, asthma, and chronic disease. I also lead the academic science in Leicester. Next slide, please. Next slide. Thank you. So the respiratory research in Leicester includes a number of different programs under what we call the Institute for Lung Health. And we're one of the biomedical research centres in the country that has a respiratory theme. So there are 6 themes within the BRCs nationally that are respiratory. This includes a number of different disciplines within respiratory medicine, including airway disease, airway infection, lung cancer, and interstitial lung disease. We're a growing group. We have 8 clinical professors of respiratory medicine, 4 who are non-clinical, and we also have lecturers and senior. And we now have a group of around about 100 members of staff that are on the campus at Untitled Hospital in Leicester. Next slide, please. So many of you will be familiar with omics. So you'll be thinking when you use the term probably of genomics and possibly transcriptomics and lipidomics. What you probably haven't considered is breathomics. So breathomics is trying to then understand all of the different constituent volatile organic compounds that you can then measure in breath. And the volatile organic compounds are going to be derived from the lung itself, but also from different organs, particularly in metabolic disease. So perhaps the commonest breath analysis that we sort of think about is things like the breathalyzer for alcohol, for when people are driving. And this is simply looking at a volatile organic compound. But every moment of every day as we breathe out thousands of different volatile organic compounds. These are representing different pathways that are ongoing within that patient, both in the lung and outside the lung. So we're focusing within EMBER on both respiratory but also cardiac causes for changing the breathome. The next slide, please. We have a number of embedded programs of work. So some of these are looking at responses to expensive therapies such as biologics. But one of the major focuses is trying to use the breathome in the acute state to try and help us understand different causes of breathlessness in the acute setting, and also how that may help us in therapies. And we consider this as being particularly important because we recognise that the proportion of patients that come in with cardiorespiratory diseases with medical admissions is very high. It's about 70% of all medical admissions. It's also a very high burden of disease in terms of mortality as well as. Next slide, please. So with all of the molecular pathology nodes, EMBER is obviously an example of this. We really see it as important to really delivering more precise medicine, so precision medicine or stratified medicine. And to do this, we feel it's very important to then be able to better understand the underlying mechanisms of disease. And the greatest insight we feel will come from fully understanding the molecular mechanism. So the molecular pathology becomes very important. You need to have focuses on particular diseases really to try and have examples, and we focus primarily on respiratory but also cardiorespiratory. And as you'll see in the forthcoming slides, collaborative, this requires not just input from the analytical chemists, but mathematicians, biostatisticians, and those clinical scientists. And then we also already have existing collaborations with a number of companies, particularly on the technology side, and some of those are mentioned here, including Aarti and BIA and Aarti. I'll come back to the importance of industry collaborations a little bit later. Next slide, please. So this is the leadership team. So we have the overall coordinator is myself. We have what we describe as being the in-clinic and ex-clinic breathomic systems, whereby we have a very well structured knowledge platform with a data stream, and then we also then have the support underlying technologies. These are led by two classes of analytical chemistry, Paul Thomas in Leicester and Parmar in Leicester. We then have the clinical work stream, which is led by my colleague Professor Siddiqui, who's a respiratory physician. And then we have a trial manager, Ms. Anisha Singapuri, and Professor Jackie Shaw, whose expertise is in biomarkers of lung cancer, is our lead for training, and Aarti, who's already spoken to, together with Bingo through AHSM, is then supporting the dissemination, coordination, and implementation of EMBER. Next slide, please. This describes the founding members of EMBER. You can see that the map is actually of the East Midlands, and it's focusing down on Leicestershire. And within Leicestershire, we only have one hospital. So we have the University Hospitals of Leicester, the UH Trust. And we have these two key universities within Leicester, the partners within EMBER, Leicester and Leicester. We also have one unifying pathology clinical service, MPATH, which then covers the region. And as you can see, we also then have a number of industry partners that have founded EMBER. Next slide, please. So as I've alluded to already, we've had a number of programs of clinical research looking at responses to high cost therapies. We also focusing down on this acute platform, looking at root causes of breathlessness in the emergency room. And this has encompassed presentations of asthma, COPD, pneumonia, and heart failure. And we're including vulnerable populations of the elderly and the adult population, but also children. And breath analysis has real value in these vulnerable populations. Sometimes sampling for other omic platforms can be more challenging, whereas provided the adult is still able to breathe, then we're able to still analyse it. We're then using a standard approach of discovery and validation, and then having a minimum number of patients for each of these different disease entities. That's ongoing at the moment, is on track for completion of recruitment by the end of this calendar year. Next slide, please. One of the challenges with Breathomics is the technology is still very much in development, and there's an enormous need for standardization in terms of the sample collection and the sample analysis and then the bioinformatics goes with that. And we're very much at the forefront of this, but also working in partnership with industry partners and also with international initiatives. So the device that's actually collecting the breath sample in the clinic that we're using as standard is at the top right of this slide, which is the receiver device. And this is being developed as an open platform initiative between industry and academia. And this is used in order to be able to collect breath into 10x tubes, which can then be studied in the laboratory. And then you can see the different types of devices that we are using, which include standard gas chromatography, mass spectrometry platforms, as well as PCMS. And then we also have what we describe as online sampling, where the patient is directly into the device, including PCR and MS, which has been a very successful way of them being able to look at patterns of breath analysis. But as you can sort of perhaps guess from looking at the slide, the device is large, and moving that to the patient is not straightforward. We then also have complementary devices which can be tuned to actually look at specific elements of the breath, such as looking at PCIMS, and different platforms that are in development for looking at iron mobility, shown here. Next slide. So within EMBER, in addition to the breath analysis, we're also collecting samples for other more traditional platforms such as genomics, transcriptomics, and proteomics. And we have a biobank both in the exemplar acute pregnancy study, but also in the interventional studies that I've already described. And that's another increasing biobank which can also be used to make use of to study other elements of the disease. Next slide, please. So that's what's most important for today, is to consider why do we have existing industry partnerships, and what the new industry partnerships actually look like. Well, as you've already seen, most of our founding partners are in the technologies that are actually important for analysing breath, and we certainly would be open to further partnerships around technologies or around ways of actually making those technologies more usable for patients, particularly near patients. There's also, as with most clinics, a real burden of knowledge, and knowledge management IT is incredibly important when we're trying to integrate these multi-scale omics. There would also be an important link with industry. And some of the opportunities that we're beginning to exploit around using these technologies in clinical trials, and that's then opened up opportunities with medium to large size pharma, which we can then support endpoints and also biomarker development within their clinical program. So really quite a broad breadth of different companies that can be involved. Next slide, please. So the way we're partnering with industry is quite bespoke. So the number of the technology companies has been very much around helping to optimize and develop the technology platforms so that they are appropriate for best analysis. There's some other companies where we're very much linked up in order to be able to share clinical data. And we can also then set up new projects that then use this as a clinical endpoint. So there really is a number of different ways of partnering with industry, and a number of successful models. And certainly, if there is interest following this webinar to further discussions, then we'll be very happy to discuss future opportunities. If we go on to the next slide, I just want to give you a taster of how some of these things have worked. So we are working closely with Alston that's developed the signature using similar platforms, particularly along PCMS and spectroscopy. And we have been working with Alston in optimizing the receiver, developing the receiver device for children. And we've also been working with them to then be in a position where we, in the future, would be able to share signatures that we identify that are either disease or related response to intervention, which could then be in the future commercialized using some of their near patient systems. We've been working with large pharma to then try and understand response to high cost therapies. The example here that we're showing is mepolizumab, a biologic that's now licensed and available for severe asthma. We've also aligned it to other programs that work with SMEs. An example here is with Logic, whose focus is around urinary biomarkers. We've been using their platform to try and validate their platform, whilst at the same time using that to integrate into data that we're developing and have available through EMBER. So actually, it's been a real win in terms of the opportunity of being able to embed studies that are important to the SME, which then add value to EMBER, and then that EMBER can add value to the SME. We also recognise it's going to be really important in terms of the adoption pathway to then work very closely with regulators and payers. And with that in mind, we've already had ongoing discussions with NICE and NHS England. These discussions will obviously need to mature further in the near future. And then next slide, please. And then the last slide is simply just showing you some of the faces, more of the faces for EMBER. Amongst this group are actually also representatives from industry. In fact, half the people there are from industry and half of the academic. I think that's a fair representation of how EMBER works. And then we've left on here contact details for myself and for Aarti. Aarti, back to you. I think we're going to introduce Karin.
Thanks very much for that, Chris. It's great to have an overview of EMBER. I'd now like to hand it over to Glasgow, and Dr. Karin Oien will introduce the Glasgow molecular pathology node together with Ruth McLaughlin.
Can you hear me okay? That's great. So I'm Karin Owen. Thank you very much, Chris and Aarti and Alex, and thanks very much also to the Bioindustry Association for giving us this opportunity to present. And thank you also all of you on the webinar and those who are listening after for joining us. You're very welcome. So I'm Karin Owen. I'm Director of the Glasgow Node, and I'm here with Ruth McLaughlin, our Node Project Manager. We'll be presenting to you as a little bit of a double act. Next slide, please. So Aarti's already described this to you a little part in some introduction. I just wanted to reiterate that I think the importance here is around stratified and precision medicine, which are supported by the MRC and many other funders and have the real opportunity to deliver better therapies for us. But that precision medicine needs high quality diagnosis and diagnostic tests. It's pathologists who diagnose tissues. And so those pathologists are key to understanding the tissues, and increasingly those tests also involve molecular level analyses, and that's evolving rapidly. And it's the requirement for a capacity and expertise that was identified within that molecular pathology review, and that expertise to discover and develop and deliver and interpret those innovative molecular pathology assays. And the funding there was offered to build and achieve that by putting together paths, proximity, and people for the centres of excellence in molecular diagnostics. Next slide, please. So what we've achieved within Glasgow is only been able to be undertaken by working together as a very large team. And what you can see on that slide there are the numbers of co-investigators and also of all of the departments that are involved. But there are many, many more people without whom none of this would have been possible. But in addition, what we do very much is working together across the areas of the university, healthcare within the NHS and industry in a full collaborative partnership. And that's what is absolutely key to this. Without that, we wouldn't be here today. So I just wanted to show you a little bit beyond that. Behind that triangle, you can see the building there, which is the large building, is our main hospital site. It's one of the largest acute hospitals in Europe. The slightly smaller building on the right-hand side is our laboratory medicine building, which is the largest laboratory medicine and pathology department within Europe, with around 47 consultants. That's fully integrated alongside molecular diagnostics and genetic services, as well as the other laboratory medicine disciplines. So it's a fantastic environment, and it's the base for our node. The sky in Glasgow today actually just now is even bluer than you've got there, and there isn't at the moment a cloud in the sky, and I have to say that's not necessarily often that we can say that here. But over on the left-hand side of the picture, right at the edge, we've also got our new Learning and Teaching Centre, where we also have industry space and capacity there for all of those together on that campus. Next slide, please. So the vision from our node is to transform the diagnosis and management of cancer, inflammation, and cardiovascular disease. And that's building on the research strengths within our university and of the institutes and of the leads of the institutes who are heavily involved in the node. We're wanting to build capacity and systems for diagnostics development and delivery and innovation in molecular pathology, as well as creating the next generation of leaders and contributing a critical node within that network. As I say, working together is critical to the success of all of this. Next slide, please. So this explains a little bit about how we're set up. Within the centre in the green box, you've got the node, which is based currently within the QEUH, the Queen Elizabeth University Hospital, within laboratory medicine. And we've got pathology and molecular diagnostics, as well as working with our NHS R&D colleagues within biorepository for tissue acquisition and handling, as well as high quality tissue clinical annotation, which is with NHS R&D Safe Haven. We're fed into from on the top there, you've got the research streams of cardiovascular, cancer and inflammation, repeating in our candidate diagnostics. And those are supported on the left by the analytical facilities, which include our Scottish Genomes Partnership, which is a collaboration across Glasgow and Edinburgh, and with colleagues from bioengineering and computer science linked to that EPSRC funding. We're also linked into our health data, which is within our NHS R&D Safe Haven, and it's high quality, and also with full health economics. And it's in partnership with our industry colleagues over on the right there, who are, again, fully integrated within the node. That's enabling us to deliver the innovative molecular diagnostics that you can see towards the bottom of the slide, round through to improved services and outcomes. Next slide, please. So people are absolutely key to this, and what we're doing with the people is to build capacity and expertise as was requested in the original review. So what we're doing is we're building particularly master's level training in molecular pathology, and we've already delivered year one successfully, and we're partway through, or nearly through, I guess, year two now, and it's been a fantastic experience and hopefully achievement as well. We've awarded a scholarship for MSc in bioinformatics to build expertise there, and that's to a healthcare professional within the hospital. We're building undergraduate activities. We also have a series of patient and public engagement events. And importantly, we're working with our wider partners, including with the node network as a whole across training, and with other initiatives and stakeholders, including the Royal College of Pathologists, the Pathological Society, the CMPath initiative and more, to enhance UK molecular pathology training as a whole and make sure that we're working together in that space. Next slide, please. So I'm going to hand over now to my colleague Ruth, who will take us through proximity and partnerships.
Thank you, Karin. So as almost everyone in this call has alluded to, it's not possible for any one organisation to develop diagnostics on their own, and so it's been key to look at how we can bring together the university, the NHS and industry to support the development of novel diagnostics. And what this diagram shows here are the different groups that the Glasgow Molecular Pathology Node is currently engaged with. So at the centre we have the nodes, and we have our 5 founding partners who were Iridia, Systemic, Thermo Fisher, Leica and Illumina, alongside NHS Greater Glasgow and Clyde. And since then we've also established a formal partnership with a company called BioClavis, who actually relocated from the west coast of America to set up a laboratory space here in Glasgow within the Queen Elizabeth University Hospital. Beyond our actual former partnerships, we also have a lot of companies who we are engaged with and are supporting some of the work that the node is undertaking, such as Menarini and Philips and Roche and others. And then we sit within the wider Scottish ecosystem for precision medicine as well. So we have that reach across the country, and we're able to draw on resources that may be in Edinburgh or Aberdeen and St Andrews, and some of the relationships and industry partnerships that are there. In order to try and facilitate these relationships and discussions, what we've done is we've established the Promoting Partnerships network that I've got an example of on the next slide. And so what we wanted to do with this partnership was create a regular opportunity where academics, industry and clinicians can get together, where they can talk about some of the interesting research that's going on, they can talk about some of the clinical needs or opportunities, and industry can come and say, look, this is what we have that can help, or potentially, look, we need some help to figure out how we take this product and get it into market or into clinical operation. And what we always try and do at those meetings is we try and have a mix of people presenting. So we always have academic, NHS and industry presentations. More recently, what we've done is we've actually started to bring this together with the Imaging Centre of Excellence as well, so that we have the molecular diagnostics people, we have the people who are interested in the imaging diagnostics, and we're starting to work together. We're starting to share conversations and expertise and challenges, and that's all really supporting the drive towards integrated diagnostics. And that's all really been enabled by being embedded here at the Queen Elizabeth University Hospital, where we have this clinical innovation zone. So we already have a number of companies based on the site. We have fantastic space for hosting events and meetings, and a lot of the clinical academics are actually housed there as well. So there are days where you could literally, you go down for a coffee and you bump into 5 people who are really useful for you to have a discussion with to support your research. So moving on to the next slide, please. So as Karin's talked about, we have the training that's supporting our people. We have this physical proximity, but we've also been working to pull people into our network as such. And what we're using that to do is to support the path for the development of diagnostics. So we have the path across the top of the slide here, from discovery through to implementation. And the node employed 12 people, so there were 12 posts across the NHS and the university, from research nurses and biomedical scientists who are based in the biorepository and can help with things like patient identification and sample collection. We have clinical scientists who are going through the training program at the moment and will therefore be there to support research and clinical delivery moving forward. We have sequencing scientists, we have MR scientists who are looking at biomarkers for cardiovascular disease. There are a range of bioinformaticians, so we have a genomics-focused informatician. We have another informatician who works on genomics, but some of the other omics like proteomics and metabolomics. We have our sort of a clinical IT developer / informatician who's there to support clinical annotation and look at how some of this research data can be brought back into the NHS systems. And then all of this is supported with our industry partners and our academics as well. We also have our health economist who's there to support all of the research projects that the node looks at, whether it's from a full health economic analysis or just a simple conversation saying, when you get to this point, this is when you need to think about some of the health economic considerations. So all of those people and all of those experts together allow us to support research projects in 4 main ways. So we have sample acquisition and sample processing. We have a number of enabling technologies that have been enabled through some of our industry partnerships. Some already existed within Glasgow and the Queen Elizabeth University Hospital. So we have access to things like laser capture microscopy and flow cytometry and histopathology and sequencing technologies. We have our team of people who can help with the analysis and interpretation, and that can be things like the data, but also we can draw on a pool of consultant pathologists as well who have said we are keen to get involved in some of this research, and we're able to donate some of our time to do this. And then we work out how we can enable translation. So that, as I mentioned, we have our health economists who's helping kind of shape and build evidence for these diagnostics. We can organise clinical consultancy where industry can come in and say, look, where is the best place for us to position this? What exactly do you need? Does this fit with your current workflow? And then we have all of our industry partners as well who offer advice to some of our academic research and help them shape that for best success. And so what we've done is we've given this whole platform or infrastructure a name that we're calling the P4D platform, which is Pathology for Discovery, Development and Delivery of Diagnostics. And I just have here a brief overview of some of the research that platform is currently supporting. If we could just hit the next slide, please. So you can see we have a pipeline of novel diagnostics that are in the discovery stage, and these span cardiovascular, inflammatory and cancer. Those are our 3 main priority research areas. We have an actual diagnostic pipeline of research that is further along that path towards implementation of a novel diagnostic that we're supporting in a variety of ways. We have a number of projects where industry have come to us and said we have something that we think would be useful in the clinic or can enhance how you're currently operating. So we're working with them to evaluate that and look at what the potential benefits could be. There is the health economic work, and a number of our projects have large pieces of health economic supportive work being done. And then we have all those projects where our pathologists or biomedical scientists are supporting research through things like histopathology or ICC. So moving on to the next slide. So this just, I guess, summarises the platform that we've built here at Glasgow to support the development of novel diagnostics. As you can see, it encompasses lots of different people with lots of different skill sets. There's a really strong NHS and university base that is then enhanced by the industry partners that we have. Underpinning all of that, we have the training that Karin talked about earlier, and that feeds into all of the research that the node supports as well. And that platform is then there for either academic, NHS or industry colleagues to access if they are working in the areas of novel diagnostics or supporting technologies in our 3 priority research areas. And then more broadly, we can, if need be, kind of scale up and out across Scotland as well to, in that precision medicine ecosystem to perhaps look at something in a second clinical site, for example. Those relationships exist that allow us to do that. So moving on to the next slide, I've just summarised, I guess, the 3 main ways that people can engage with that P4D platform and what the opportunities are. So there's the opportunity for our academics or our NHS colleagues who have an idea, they've seen a gap, or they have something that they've discovered that has clinical potential. So there's that opportunity for them to use this platform to support that translational research, leading to the commercialisation of research outputs. We then have, I guess, the industry-led side of things, where industry can come to us and say, we need to test something in the clinical setting, or we need to talk to a pathologist or a clinical scientist to figure out how best to position this and how we can work with you to generate the evidence that we then want to take to, NICE or whoever it may be to support the adoption and implementation of your diagnostic. And then aligned with the training, there's the opportunity as well for industry-sponsored PhD studentships. We also look for opportunities to support the training of some of the node staff as well, to perhaps go and learn new techniques by spending some time, with industry or doing a secondment, and that can be around particular, sort of wet-based lab techniques, but it might also be around understanding how does it work in industry and how do I think about things from a commercial or an economic point of view. And so moving on to the next slide, I thought it'd be useful just to talk a little bit more about some specific examples of some of the research that's going on that we are supporting. So I've talked quite a lot about the P4D platform and everything that the platform encompasses, and I hope that you can see how that supports the path to diagnostic development by linking with the NHS, with academics, with industry, with lots of different broad skill sets that are all aligned to the development of diagnostics. Within the cancer work strand, one of the main flagship projects that we're supporting is called Precision Panc, which is there to support the clinical evolution of pancreatic cancer. It's a very large program of work that includes discovery, preclinical and clinical research. Through the node, we have supported the development of the GPOL lab, which is the Glasgow Precision Oncology Laboratory, which is a sequencing facility that is now aligned and accredited with the diagnostic laboratories here. And what that laboratory is doing is it's receiving clinical samples, it is putting them through a pancreatic cancer diagnostic panel that they have designed. They're using the data that comes back from that panel to direct patients to specific clinical trials, and that's also allowing them as well to evaluate and validate the panel for potential commercialization further downstream. Our inflammation work strand is focused predominantly on rheumatoid arthritis at this point. We have a project where we're working with Professor Ian McInnes that's looking at a genomic signature that predicts response to biological therapies in patients with moderate rheumatoid arthritis. And what we've actually managed to do with that particular project is we've actually managed to link that with BioClavis, one of our industry partners as well, who are actually taking the development assay as such and helping them move it towards something that can be scaled up and rolled out across the board should it be successful. Within the cardiovascular work strand, we've got a range of different projects that we're working to support, but one of the most interesting ones is linked up with our bioengineers and computing science people, and they're looking at point of care diagnostic for some of the routine cardiovascular biomarkers that could potentially be used by GPs, but also then has broader applications, to things like developing countries or military applications and such like. I'm going to gloss over the training because I'll let Karin talk about that one in a moment, and I just want to talk a little bit about the network activities. So as Karin mentioned, the nodes function very much as a network, although there are 6 of us and we all have our own unique areas in which we are focused on. We very much talk to each other, we share opportunities and challenges, and there are 3 main areas where we've worked particularly closely together. So one is on the training side of things. We all have our own masters in molecular pathology, and what we've tried to do is make sure that we communicate and share so that regardless of which node you do your masters through, you all achieve the same sort of learning outcomes and level of expertise. We have health economics, so across the node network, and there've been a number of workshops and discussions with the health economists within the nodes, but also the decks that are now the mix that exists to support building evidence and supporting companies with regulation of diagnostics. So they have been working together to look at what are the health economics of diagnostics and particularly precision diagnostics. And then there are informaticians across the node network as well who have been sharing and talking as well and trying to just, I guess, exchange that knowledge and see how can we help each other and what are the big challenges that we're all trying to address and can we kind of work together to support some of that. So with that, I'll just let Karin talk about the training and then finish off from there.
Okay, sorry, if you can go back to the can you go back? Thank you very much. So the training's been exceptionally exciting. It's been fantastic to be able to help to deliver a cohort of people who are both trainee and consultant pathologists, but also clinical scientists. who are then developing or having the skills there to provide and interpret and undertake molecular pathology testing. But in addition, we're also helping to develop the research leaders for the future in pathology and molecular pathology. So one of our trainees who undertook towards the end of her training part of the molecular pathology masters has subsequently gone on to help in research within cardiovascular and autopsy pathology, which is amongst her specialist areas. So she's helping to build a local cardiovascular biorepository. She's been contributing to the multi-centre study run by Cancer Research UK called PEACE. And she's also been a co-I on an MRC Stratified Medicine Consortium bid as well, and that's all within a year of becoming a consultant. So it's been fantastic to see, and just a great opportunity afforded by the funding provided here. And Ruth there has been emphasising what we've achieved through collaboration and what can be leveraged. And I'll just show you more with the next slide, please. So what this is one example of what's been achieved, linking in with the nodes, but also much more with the wider investment by MRC and wider funders. So the IMID Bio is a biobank on immune-mediated inflammatory disease, and it has built on the investment through the Stratified Medicine Consortia, as well as with the molecular pathology nodes. For this particular biobank, the vision is to bring together the biosamples and the clinical data and the multi-omic data, all very deeply annotated and highly curated, to build a successful national database of inflammatory disease across a range of disease areas, which subsequently will be made available to researchers and industry partners to study inflammatory disease biology and predict drug response, enabling optimization of care pathways and for patient benefit, and to enable the identification, hopefully, of new disease targets and treatments. And that's been built off the back and leveraged through funding like this from the nodes. And I know that there's been a number of other examples across the various nodes. This was just one, but it just shows what we can do when we build together. And that was not only from the MRC, but also from NIHR and CSO and other kind of government level investment. Next slide, please. So that's where we've got to so far, but there's a lot of fantastic opportunities for the future. And what I'm showing you here is that on the top left, Glasgow within Scotland is one of the sites that's been identified for the Science and Innovation Audits on precision medicine within Scotland. And within that, from Glasgow, we're based as a partnership across university, NHS and industry on this QAUH campus, where we've not only got the buildings that you see there, but also a new now imaging centre of excellence with a clinical innovation zone with industry space for the potential for hubs. And that builds on all the efforts from the molecular pathology nodes, both in Glasgow and much more widely, across the 6 centres, to build people proximity and paths. And there's going to be further opportunities afforded by the new government and UKRI emphasis and opportunities around digital pathology, where there's data integration and AI, enabling imaging, both digital and radiology and pathology to be linked in, enabling us to get towards integrated diagnostics development and delivery for precision medicine across all the different platforms and technologies. So that's our kind of vision for the future. Next slide, please. So I was talking there about Glasgow, but obviously there's the Scottish ecosystem for precision medicine, which Ruth and I have both mentioned. And there you can see that there's 2 nodes, both in Edinburgh and Glasgow, but it operates obviously much more widely and with other partners, with other university partners, with NHS Scotland as the healthcare partner. So there's an overarching NHS system. And that benefits from the fact that that the patients have fantastic there's fantastic healthcare and underpinning data and an e-health system where patients have one single unique patient identifier from, as they say, from cradle to grave, that enables good healthcare because it enables their care and to be followed up, but also that then enables research both by academia, by healthcare and by industry, again for patient benefit. And so there's fantastic opportunities there. Next slide, please. And that obviously embedded within the wider UK healthcare system and economy as a whole. So that kind of brings us back to the Stratified Medicine initiatives and consortia. And it's been absolutely fantastic to be part of the nodes, actually. I really, really have enjoyed it. I'm just sad that we don't have the opportunity to have all of us talking to you today, but it's been absolutely brilliant. It's been wonderful from pathology to have the chance to work together. And I think that there's a lot of scope, as you can see there, for working together for the future alongside a range of technologies, be that molecular imaging or other technologies, partnering with our Stratified Medicine colleagues and wider UKRI, again for the benefit of patients and healthcare and for the wider economy. So it's been a pleasure to speak with you. It's a pleasure to be part of the nodes, and thank you very much.
Thank you both. Thank you very much to all the speakers for this comprehensive overview of just two of the pathology nodes. As Karin says, it would be interesting to hear from all of them, but don't quite have time for that today. So if anyone has any questions, please do type into the question box on your webinar panel, and we can open this up to the speakers. If you think of anything later, any questions later on, you can also email, and we're happy to forward these on to the speakers if you think of anything later. So any questions out there? Okay, well, if not, we will say again, thank you very much to all the speakers for taking part in this webinar. I have just a couple of words from us. We are the BIA, the Trade Association for Innovative Life Sciences in the UK. If you're not a member and you're interested in joining, please do get in contact or go to our website for more information. So on this slide, I have a few events coming up in the near future. Some of note are we have Women in Biotech, which is next week on the 14th of June in London. We have our joint MHRA BIA conference in London on medicines regulation. And then we have our annual Bioscience Forum on the 18th of October, which is open for early bird registration now. So please do go to our website, which is www.bioindustry.org, and look at our website and our other events. And as I said before, this webinar will go up on the BIA YouTube channel from next week. We will email you the link early next week, so please feel free to forward this link on to any colleagues or people that you think might be interested. Thank you very much again to our speakers and everyone who joined the webinar, and please have a good evening.